Hello everyone, my name is Vartika and I'm currently in the last year of my internal medicine residency training at the University of Connecticut. I am a former graduate from AIIMS Jodhpur. I graduated in 2018 and then went on to pursue my residency training here in the United States. So yeah, I'm really happy to be here today and share my experience with all of you. Firstly, I would like to begin by congratulating all of you for being selected at such a fine institution. I can assure you that you made the right choice by coming to AIIMS Jodhpur for your medical school training. It is truly a phenomenal institution and it has all the resources that you would ever require to be set up for a successful career in medicine. I can tell you from my experience that I personally believe I received a very sound clinical training at AIIMS Jodhpur. And not only that, I ended up building some lifelong relationship with the professors there and my co-students who are now my mentors and friends. I still look up to them for professional guidance and personal advice, and I can tell you that I've never been disappointed. So yeah, I had an amazing time at AIIMS Jodhpur and I truly hope that you share the same experience as well. So before we begin, I would just like to point out some key differences that medical school has compared to the traditional schooling you've received so far. So medical school is different in the regard that whatever knowledge and skill sets that you will acquire during these 5.5 years of your training, you will be carrying these skills and knowledge throughout your life. You will be using it on an everyday basis to treat patients and in clinical practice. So this is not something that you can just take tests and pass exams and just get away with it. You really have to master these skills because this is what is going to set you up for a successful professional career. The second key difference is that unlike schooling, medical school is the time where you actually take charge of your own learning. You will not have anybody telling you what to do and how, just monitor your progress at every point. This is the time where you take ownership of your own learning, act responsibly, and whatever you put in is what you get out. So it's really going to come down to your efforts regarding how successful these 5 years of your training at AIIMS Jodhpur is going to be. So that being said, while it's impossible to cover every single aspect that will set you up for a successful career, I would just like to share my thoughts on the 5 essential skills that I think are required to succeed in medicine. And I think it's very easy to develop during those 5 years in medical school as well. So the first most important thing is developing a very strong foundation of medical knowledge. The way I see medical knowledge divided is in 2 phases. The first 3 years of your medical school, where you will be spending time with the basic sciences, and then the last 2.5 years of your medical school, where you will be studying the clinical sciences. So my advice for the first 3 years, where you will be spending time with the basic sciences, is that really turn to your textbooks. Use standardized textbooks like reading Robbins for pathology or reading Genong for physiology. So spend time with these textbooks, try to grasp the concepts of these basic sciences, use different study techniques, and really try to understand what these subjects are all about. Because the basic sciences is going to lay the foundation of clinical science. If your foundation in basic sciences is a little bit shaken, it's going to become really hard to catch up and master clinical subjects. So I would suggest that you really utilize these 3 years developing a strong foundation in all these core subjects. One thing that I would like to highly advise against is using guidebooks. It is very tempting sometimes to just sit 2 days before the test, read for the test using guidebooks and just blast with fine colors. But just passing a test is not the point of medical school. You're really trying to learn the concept which are going to set you up for your professional career. And that can only be achieved by reading core textbooks and developing concepts. So I would highly encourage staying away from guidebooks, spending time with the core textbooks. So that is in part for the basic sciences. For your next 2.5 years in clinical sciences, while you'll be spending a lot of time spent learning the subjects like internal medicine, pediatrics, gynecology, ENT, what the most important skill that you can learn in these 2.5 years is really how to take a good history, perform a very comprehensive physical exam, and how to develop a differential diagnosis. So if you master nobody's gonna like fault you for forgetting the dose of doxycycline, but you will have a really hard time mastering clinical medicine if you don't know how to take a good history, do a good physical exam, or you don't understand the art of formulating differential diagnosis. So I would really advise you all to spend these 2.5 years of your medical school to get a good grasp on history, physical exam, and formulating differential diagnosis. So if you graduate from medical school having a good grasp on the basic sciences subject, knowing how to take a comprehensive history, knowing how to conduct a good physical exam, and coming up with a good differential diagnosis, I think you're pretty set from the medical knowledge perspective to step into the next role in your life. The second very important skill, which is especially relevant now in the current times in medicine, is how to interpret medical literature. So medicine is an evolving science. New types of diagnosis, new types of management criteria, new therapeutic modalities are coming out every single day. So it's really hard to keep up with these new changes in medicine. When you graduate from medical school, regardless of whether you choose to practice as an MBBS physician or you choose to go into a subspecialty training, you will be approached by pharmaceutical representatives who will be throwing all of these new treatment options at you, backed up by different clinical trials, randomized controlled trials, etc. So in such times, it's very important to understand how to take a decision regarding, okay, I'm being presented with something. Is this really relevant to my practice? So how do you answer that question? That can only be answered if you have a good grasp on how to interpret medical literature. So my advice to you guys would be to read one publication or one paper almost like every month or 2 months. Start early on. You can even start as early as your first year of medical school. Try to analyze the content of the study. How was the study designed? What was done well? What are the shortcomings of the study? Are these findings applicable to my patient population? If so, how can I use this to change clinical practice? So asking those questions yourself early on and being comfortable with interpreting medical literature, I think is going to be a very, very important skill, especially in the upcoming times when medicine is changing so rapidly. So if you're just able to do that by the end of 5 years, I think you're going to be very, very successful later on. You can go a little step further and you can also be involved in creating content, which means being involved in conducting research, writing case reports, writing review articles. And if you need any help with all of that, you can always reach out to me, or you can find a mentor in medical school who would be happy to guide you with that as well. So yeah, interpreting and being able to contribute to medical literature, I think, is an essential skill, mostly because we're advancing in medical science. We're at the brim of making some breakthrough discoveries. The third important skill, I would say, is developing good interpersonal skills. So we're living in a time where you are constantly interacting, especially as physicians, you're constantly interacting with members of other teams. You will be interacting with patients, your colleagues, members in other subspecialties. So this is a process of just being involved in a professional environment. So you need to learn how to interact with these people in a professional manner. So my advice for developing this skill set would be take every opportunity at public speaking that you can get. Try to get yourself involved with debating, presenting your findings, making PowerPoint presentations for lectures, going to medical conferences, presenting your work at conferences. So just learning how to speak publicly and how to present your findings and how to express yourself is going to be an essential skill, especially in the coming years in medicine. So if you can get any opportunity to develop that, I would highly encourage you all to do that. The fourth important thing is finding a mentor. While I do believe that all of you who have reached so far in life are all capable of going further and finding your own ways, I cannot stress enough the importance of a mentor in life. Having a person who you can look up to, use as a reference point for measuring your own growth, and just going to him or her for personal advice or professional guidance can really catalyze your growth. It can get you to the same point that you want to get, just at a faster pace and with much less difficulty than if you were trying to attempt that yourself. So finding a mentor early on in your career, even as early as starting the first year of medical school, I think is going to be really helpful going forward in your professional career. And it doesn't have to be one mentor. You can have more than one mentors. I have two mentors, somebody I look up to for clinical advice and somebody I look up to for personal advice. So really just finding who you resonate with the most, who do you see as a role model, and how do you see yourself being shaped as a physician is very important in finding a mentor. So I would highly encourage you to be on the lookout for that as well. And last but not the least is developing a hobby. So you have just started your journey in medicine. It's going to be a long journey. Sometimes it's also challenging going, especially the next step of your career when you step into a subspecialty of your choice. It can sometimes get physically and mentally very demanding, and that can lead to stress. So you might have some good days, you can have some bad days. So it's really important for you to have a life outside of medicine, which typically involves having a hobby. Pick something of your choice, regardless of what it is. If you enjoy singing, dancing, reading, cycling, doing sports, going to the gym, whatever your area of interest is, try to cultivate that as well during these 5 years. Just spending 2 or 3 days a week doing something for yourself, which is outside of medicine, is really the key to just de-stress and blow off the steam a little bit. So in my opinion, if you graduate from medical school having these 5 skills handy, namely having a good grasp of medical knowledge, which is a good foundation for basic sciences, good history taking skills, good physical examination skill, formulating a differential diagnosis, knowing how to interpret medical literature if not contribute to it, having good interpersonal skills, knowing how to present your work, having a strong mentor, and having a hobby. If you have these 5 essential skills, I think you're pretty much set for a successful career going forward in medicine. So these are just my pearls of wisdom, if you would say so. I know that this is not everything that you require, but hopefully this is some of the things that are key and will help at least some of you spend your time meaningfully at AIIMS Jodhpur. Again, if you have any questions, if you want to chat about just medical school in general, if you need any help with any form of research projects or just career advice or whatever it is, you feel free to reach out to me. I will share my email with Dr. Bharadwaj and he can disseminate it amongst whoever needs it. But otherwise, I wish you all the best. I am very optimistic that all of you will go ahead and achieve great things in life. And lastly, I would like to thank the administration at AIIMS Jodhpur and Dr. Bharadwaj for giving me the opportunity to be here with all of you today. Thank you.